There is a particular kind of tiredness that only people with circulation problems truly understand. It is not the tiredness that comes from a long day of physical work, the satisfying ache of muscles that earned their rest. It is heavier than that, more insistent. A weighted, throbbing fatigue that settles into the legs sometime in the late afternoon, and by evening has become a presence that is impossible to ignore. The legs that feel like they are filled with something dense, the ankles that have swollen over the course of the day, until the shoes that fit fine in the morning no longer do, the feet that burn and pulse when you finally sit down. The restlessness that makes it impossible to find a comfortable position in bed. For millions of Americans over 50, this is not a complaint. It is a daily reality, one that is dismissed too often as simply getting older, accepted too easily as an unavoidable feature of midlife and beyond, and addressed too rarely with the specificity and effectiveness that the research actually supports. Today we are going to talk about a 5-minute nighttime ritual, a specific structured sequence of positions, movements, and interventions that the research on venous circulation, lymphatic drainage, and peripheral vascular health has shown to produce measurable relief from the symptoms of poor lower limb circulation. Not a treatment protocol that requires equipment, specialist appointments, or pharmaceutical intervention. A nightly routine, performed in bed or beside it, that works with the body's own circulatory and lymphatic mechanics to reverse the fluid accumulation, venous pooling, and vascular stagnation that produces the heavy, aching, swollen legs that most adults over 50 have come to accept as normal. Before we walk through the ritual itself, we need to spend a few minutes on the biology, because understanding what is happening inside the legs during the day is what makes the nighttime intervention make sense, and because most people who experience heavy and tired legs have never had the underlying mechanism clearly explained to them. The venous circulation in the lower extremities faces a challenge that is, from a purely mechanical standpoint, extraordinary. The heart pumps blood to the legs through the arterial system, with the full pressure of the cardiac contraction behind it. But that blood must return to the heart against gravity, from the ankles and feet, up the length of the leg, through the pelvis, and back to the right side of the heart. The veins that carry this return circulation do so without a pump of their own. They rely instead on a trio of mechanisms that work together to move blood upward against gravitational resistance: the muscular pump, the respiratory pump, and the venous valves. The muscular pump is exactly what it sounds like. When the calf muscles contract during walking, they compress the deep veins of the lower leg, pushing blood upward toward the heart. Each step you take is a pumping action. The calf is often called the second heart precisely because of the critical role it plays in venous return. When you are standing still or sitting for extended periods, this pump is inactive. Blood pools in the dependent veins, pressure builds, fluid is pushed out of the venous capillaries into the surrounding tissue, producing the edema, heaviness, and discomfort that characterize venous insufficiency and the end-of-day leg fatigue that most older adults experience. The venous valves, small flaps within the veins that prevent backflow and ensure blood moves in only one direction toward the heart, become progressively less competent with age and with the cumulative effects of standing, pregnancy, obesity, and the inflammatory changes associated with varicose veins. When these valves fail to close properly, blood refluxes downward during each period of inactivity, increasing the venous pressure in the lower leg and accelerating the fluid leakage into tissue that produces swelling and discomfort. The lymphatic system runs parallel to the venous system and performs the critical function of returning the fluid that leaks out of capillaries, including the excess fluid produced by elevated venous pressure, back into the circulation. Like the venous system, the lymphatic vessels of the legs rely on muscular compression and movement to propel lymph upward. When movement is insufficient, lymphatic return slows, and the interstitial fluid that accumulates during the day cannot be efficiently cleared. This is why legs that are heavy and swollen in the evening feel substantially better after a night of recumbent rest. The horizontal position eliminates the gravitational gradient, passive lymphatic and venous drainage occur during sleep, and the swelling that accumulated during the day is partially reabsorbed. The nighttime ritual we are about to describe accelerates and amplifies this natural overnight recovery process. It does not wait for passive reabsorption to occur over the course of sleeping hours. It actively engages the mechanisms of venous and lymphatic return in a targeted, structured way that produces more complete fluid clearance, more thorough venous decompression, and more meaningful overnight recovery than lying horizontal alone can achieve. The ritual consists of 5 components, each lasting approximately 1 minute, performed in sequence immediately before going to sleep. Together they take 5 minutes. Together they work through every significant mechanism of lower limb venous and lymphatic return, and together, practiced consistently every night, they produce the kind of cumulative improvement in lower limb circulation that most people in their 50s and 60s have never been offered as a clear, actionable protocol. Let us begin. The first component is leg elevation, specifically therapeutic leg elevation at the correct angle and duration that produces meaningful venous and lymphatic drainage rather than the modest positional change of simply placing a pillow under the ankles. For therapeutic leg elevation to produce hemodynamic benefit, actual reduction in venous pressure and active drainage of accumulated fluid, the legs need to be elevated above the level of the heart by at least 30 to 45 degrees. A standard pillow under the ankles elevates the heels by perhaps 5 to 10 degrees, which does not create the pressure gradient required for passive venous drainage to overcome the residual hydrostatic pressure in the lower limb veins. Research published in the Journal of Vascular Surgery found that elevation angles of 30 degrees or greater produced significant reductions in lower extremity venous pressure and measurable reductions in edema volume in patients with chronic venous insufficiency, while elevation angles below 15 degrees produced no hemodynamically meaningful change from lying flat. The practical implementation is a firm wedge pillow or a folded set of pillows placed under the entire lower leg, from calf to heel, that raises the ankles to approximately the height of the heart or slightly above, with the knees remaining slightly bent for comfort. 1 minute of therapeutic leg elevation at the correct angle begins the drainage process by passively moving accumulated venous blood and edematous fluid toward the core, reducing the venous pressure gradient that is the primary driver of overnight fluid reabsorption. The second component is gentle ankle pumping, an exercise so simple that most people dismiss it as insufficiently therapeutic, and whose clinical evidence base is robust enough that it is used in post-surgical settings to prevent deep vein thrombosis and is recommended by vascular medicine specialists as the single most effective non-pharmacological intervention for venous insufficiency symptom. Ankle pumping activates the calf muscle pump through a small controlled movement. Lying with the legs elevated, you flex and extend the foot at the ankle, pulling the toes toward the shin, then pushing them away. In a rhythmic, deliberate sequence, each contraction of the calf muscles during this movement compresses the deep venous system of the lower leg, pushing blood upward toward the popliteal vein and beyond. Research published in the journal Phlebology found that a protocol of ankle pumping performed at approximately 1 pump per second for 60 seconds produced venous blood flow velocities in the popliteal vein comparable to those achieved during normal walking. This means that 1 minute of ankle pumping, performed lying in bed, with no weight bearing, with no joint stress, activates the calf venous pump as effectively as walking, in a position that also provides the gravitational benefit of leg elevation simultaneously. The third component is self-lymphatic drainage massage, a simplified version of the manual lymphatic drainage technique used by physiotherapists in the management of lymphedema and chronic venous insufficiency, adapted for self-administration in a 5-minute home routine. The lymphatic vessels of the lower extremities drain into inguinal lymph nodes in the groin region. The self-massage technique begins at the thigh, not at the ankle, because you must first clear the receiving vessels before draining the distal fluid into them. With the legs slightly elevated and the hands placed on the inner thigh, apply gentle sweeping pressure directed upward toward the groin using the flat surface of the palm. The pressure should be light, firmer than a feather stroke, but lighter than a typical massage, equivalent to the pressure you would use to gently stretch a piece of fabric. Approximately 10 sweeping strokes along the inner thigh, then 10 along the outer thigh, moving progressively toward the knee. Research published in the journal Lymphology found that self-administered lymphatic drainage massage in patients with chronic lower limb edema produced significant reductions in limb volume and significant improvements in symptom scores, heaviness, tightness, and discomfort, when performed consistently for as little as 5 minutes per session. Before we continue with the final 2 components, here is a pause for you. Do you experience the heavy, tired, swollen legs we have been describing? Has a physician ever offered you a specific nighttime routine for this symptom? Or has it been dismissed or attributed simply to aging? Drop a comment below right now. Your experience with this symptom is one of the most common and most undertreated in the 50-plus population, and your honesty here helps us understand exactly what this community needs. The fourth component is the legs up the wall position, a yoga-derived posture that has independently accumulated a clinical evidence base for venous and lymphatic relief that is entirely consistent with the vascular physiology we have been discussing. The position is simple. Lie on the floor or on the bed adjacent to a wall and extend both legs vertically up the wall surface, allowing gravity to drain the lower limb venous and lymphatic system passively but efficiently. The hips should be as close to the wall as comfortable, with a rolled towel or thin pillow under the lower back if needed for support. The legs should be relaxed and the feet gently flexed or resting passively against the wall surface. In this position, the legs are elevated at approximately 90 degrees relative to the body, well above the therapeutic threshold, and the elevation is maintained effortlessly by the wall rather than by muscular effort. The position has been shown in research published in the journal Heart to produce measurable increases in cardiac preload, the volume of blood returning to the heart, through the passive venous drainage it produces, with a corresponding temporary reduction in heart rate that reflects the more efficient cardiac filling the elevated venous return enables. The fifth and final component is the application of coolness to the lower legs and feet, specifically a cool cloth or cool water rinse applied to the calves and feet for approximately 60 seconds before lying down. Cool temperature applied to the skin produces vasoconstriction in the superficial venous system, reducing the back pressure from the dilated surface veins that contributes to the burning and throbbing discomfort of venous insufficiency symptoms. It simultaneously activates a response that temporarily increases venous tone, the intrinsic contractility of the venous wall, improving the efficiency of venous return during the initial phase of recumbency. Research published in the European Journal of Vascular and Endovascular Surgery found that contrast hydrotherapy, alternating warm and cool water applications to the lower limbs, significantly improved venous flow parameters, reduced subjective heaviness scores, and improved sleep quality in patients with chronic venous insufficiency, with the cool ending protocol producing superior outcomes. A brief cool water rinse to the legs before bed captures this effect in a simple, accessible form. Hydration deserves specific mention because its effect on blood viscosity is direct and almost universally underappreciated. Dehydration causes blood to thicken, moving more slowly through the venous system where gravity already imposes the maximum resistance to return. The result is increased venous stasis that worsens both the symptoms of venous insufficiency and the risk of clot formation. 8 or more glasses of water per day is genuinely relevant to lower limb circulation, with timing favoring morning and early afternoon consumption over evening. Specific dietary compounds have documented effects on venous wall integrity. Dark berries, blueberries, blackberries, and bilberries contain anthocyanins that improve venous tone and reduce the leakage of fluid from venous capillaries. A study published in the Journal of Nutritional Biochemistry found that daily bilberry extract supplementation significantly reduced lower limb venous pressure and edema in patients with chronic venous insufficiency over an 8-week period. Vitamin C supports collagen synthesis in venous walls. These dietary supports work most effectively in combination with the mechanical ritual. The connection between magnesium deficiency and restless, uncomfortable legs in the evening deserves specific mention. Restless legs syndrome, the neurological condition characterized by an irresistible urge to move the legs with uncomfortable sensations, typically worsening in the evening, affects significantly more older adults than younger populations and frequently coexists with venous insufficiency symptoms. Magnesium's role involves its function as an NMDA receptor antagonist, gating the sensory amplification that makes the discomfort feel larger than the tissue state alone would justify. A clinical study published in the journal Sleep found that magnesium supplementation in patients with mild to moderate restless leg syndrome and insomnia produced significant improvements in both symptom severity and sleep quality over a 4 to 6 week treatment period. For adults managing heavy, tired, restless legs in the evening, the combination of the 5-minute nighttime venous drainage ritual with adequate magnesium glycinate taken in the evening addresses both the vascular component through mechanical drainage and the neurological component through sensory modulation, through complementary and non-overlapping mechanisms. No responsible discussion of lower limb circulation symptoms is complete without clear guidance on when symptoms warrant medical evaluation rather than home management. Seek medical evaluation promptly if lower limb swelling is sudden, unilateral, or accompanied by pain or warmth in the calf. These features are characteristic of deep vein thrombosis, a blood clot in the deep venous system, which is a medical emergency. DVT is not the same as the bilateral, gradual, end-of-day swelling of chronic venous insufficiency, but the consequences of missed DVT are severe enough that the threshold for seeking evaluation should be low. Seek evaluation if lower limb edema is accompanied by shortness of breath or fatigue with minimal exertion, features that may indicate cardiac failure. Seek evaluation if skin changes develop alongside swelling, skin that becomes brown, hardened, or scaly around the ankles, or that develops open sores, as these indicate advanced chronic venous insufficiency requiring specialist assessment. For the vast majority of adults over 50 who experience bilateral, gradually progressive, end-of-day lower limb heaviness and swelling that improves with elevation and rest, the symptom profile this video has been addressing, the 5-minute nighttime ritual, the daytime movement habits, the dietary supports and compression stockings represent a complete and evidence-supported home management. NT strategy. Diosmin and hesperidin, bioflavonoids found in citrus fruits and available as standardized supplements, have documented evidence from multiple randomized controlled trials for reducing venous insufficiency symptoms. A meta-analysis published in the journal Angiology found that micronized purified flavonoid fraction containing diosmin and hesperidin significantly reduced leg heaviness, aching, and swelling in patients with chronic venous insufficiency across multiple independent trials. Horse chestnut seed extract containing the active compound aeskin has an equally robust clinical evidence base. A Cochrane review of randomized controlled trials examining horse chestnut seed extract for chronic venous insufficiency found significant reductions in leg pain, edema volume, and heaviness compared to placebo. Aeskin works by inhibiting the enzymes that break down the extracellular matrix of venous walls, increasing venous wall strength and reducing the permeability that allows fluid to leak into surrounding tissue. Compression stockings, graduated compression garments applying the highest pressure at the ankle and progressively less pressure moving up the leg, are the most extensively studied non-surgical intervention for chronic venous insufficiency. Class I compression at 15 to 20 millimeters of mercury is appropriate for most people with end-of-day leg fatigue and mild swelling and is available without prescription. Worn consistently during waking hours, graduated compression stockings reduce the amount of fluid that accumulates during the day and therefore reduce the burden that the nighttime ritual must address. Let us bring the complete picture together. Evening. Before bed, take 5 minutes. Therapeutic leg elevation at the correct angle for 1 minute. Ankle pumping in the elevated position for 1 minute. Gentle self-lymphatic drainage massage from thigh to knee for 1 minute. Legs up the wall for 1 minute. Cool water or cool cloth to the calves and feet for 1 minute. This sequence works through venous drainage, active calf pump activation, lymphatic clearance, gravitational decompression, and venous tone restoration, addressing every significant mechanism of lower limb fluid accumulation in 5 minutes. The legs that have felt heavy and tired since mid-afternoon, the shoes that do not fit by evening, the burning that starts when you finally sit down. These are not inevitable features of aging. They are the predictable consequences of venous and lymphatic physiology meeting the demands of modern sedentary life, and they respond meaningfully and measurably to the specific interventions that the research supports. 5 minutes every night starting tonight. If this video gave you a specific, actionable, evidence-based nighttime protocol for something that has been affecting your daily comfort and your sleep quality for years, please support this channel. Hit the like button right now. Subscribe so you never miss a video, and leave a comment below. Tell us whether heavy, tired legs are something you experience, whether you have tried any of these approaches before, and which component of the 5-minute ritual you are going to start with tonight. We read every comment, and your experience shapes every video we create for this community. Tonight, 5 minutes. Start at the legs up the wall. The rest will follow. Thank you for watching. We will see you in the next one.